Eales disease is a particular condition in which the vessels of the retina is affected. Retina is the innermost layer of the eye and it is responsible for the vision. So, any disease or any pathology of this particular structure will bring or develop visual defects. Here, in the retina, the blood vessels are mostly affected. Actually, it is an inflammatory condition of the blood vessels, vasculitis, we can say. So, indirectly, it is coming to the development of some pathology in the blood also. So, from the description itself, we can understand that there will be visual defects in a way or another in Eales disease. So, it has different conditions or different clinical stages, and the main things are different types of pathological changes. One is this first stage will be inflammation of the blood vessels, the vessels only. Then another stage or another condition is blockages or occlusions in the blood vessels. And another condition is bleeding or hemorrhages from these vessels. The hemorrhage may be inside the retinal layers or into the deeper layers of the retina, named as retinal hemorrhage. Or sometimes it may be, if it is in deep way or in severe way, it may bleed to the vitreous humor, to the anterior side. Then it is known as vitreous hemorrhage. Both are serious anyway, but vitreous hemorrhage becomes little more serious and little more vast in its amount and its quantity. These are the different types, and as a result of this blockage or hemorrhage, there will be hypoxic area in the retinal surface. That means lack of blood supply, and there will be some lack of functional capacity also to retinal cells. So, to compensate this deficiency, there will be development of new vessels from the neighboring vessels. That is known as neovascularization, development of new vessels. This will be more delicate and bleeding will be still more easy. So, neovascularization is another complication or another later stage of the disease. So, vasculitis or inflammation of the blood vessels, then blockages, then bleeding, then neovascularization, these are all different pathological changes seen in Eales disease. And the most interesting factor is that usually the victims are young adults who are otherwise healthy, without any reason, without any previous incidents, this may develop. Usually it is said that with the age of between 20 to 30, mainly male adults. That itself makes the condition more serious. If the youth are affected, the situation is little more serious anyway. So, immediate treatment becomes necessary. But what happens usually in the initial stages, there will not be any considerable visual defects or changes or signs and symptoms. So, it will be left untreated or left unnoticed. If you go to an ophthalmologist or an expert hands, even by an ophthalmic ophthalmic examination within this ophthalmoscope itself, we can understand that. But since it is unnoticed, they will not go to an expert. The first symptom will be some congestion of the blood vessels or some abnormal texture of the blood vessels or minute dot and dots of the hemorrhage like that. If the disease is diagnosed in that stage, treatment is very easy. Otherwise, after hemorrhage or after being happened already with this hemorrhage or retinal hemorrhage or like that, the treatment become more serious. Now, coming to the Ayurvedic side of treatment, any changes or any pathology related to blood vessels is due to the vitiation of Pitta. So, we have to consider Pitta as the vitiating factor in the case of Eales disease. As an associated factor, Kapha also will come to the picture. So, the main aim of the treatment is to control the vitiation of Pitta. Since the pathological change is this inflammation, a term comes into the picture, that is Robana. So, Robana and Pitta Shamana. Pitta Shamana means to make the Pitta normal. So, that type of approach will give the results. For that, there are different methods in Ayurveda. Mainly we can divide it into three sections. One is local or ophthalmic medications. Other is generalized treatment procedures. Third is oral medications. This pattern will give the results. And for the purpose of local medications, there are different treatment procedures named as Netra Kriya Kalpa. The term is like that. That is, some procedures which are specially modified and modulated for the purpose of eye treatments. These are arranged in such a way to get maximum results or maximum absorption of the medicines applied. So, for a particular disease, for a particular structure, we have to select a particular treatment methods. These are mainly Aschodana, then Sega, then Anjanam, then Podabhagam, Tarpanam, like that. So, we have to select which particular method is useful in a particular treatment and a particular disease. Here, the most suitable procedure will be Sega and then Vitalaka, then Aschodana, like that. So, we have to select another group of medicine for this application, which gives Pitta Shamana or to control Pitta vitiation and give the result of Robana. For that, we have to select a particular group of medicines. Medicine means raw materials to be prepared as medicines, and we can use it in the form of this procedures I told, Sega, Aschodana, like that. So, the concept of treatment is mainly Pitta Shamana and Robana with the appropriate medicines, and this will give full result, no problem. But once it is already formed this vitreous hemorrhage, that means the complicated later stage, then the treatment will be very tough, because we have to arrest the bleeding first and then to drain it out. We can just imagine what will be the treatment method in a bleeding stage. It will be first, it should be to arrest the bleeding, otherwise we can't go forward. So, to arrest a bleeding is the method will be different from that of draining out the clots. It is entirely different. That is the seriousness of the disease and the complication of the treatment methods. That is same in any system, not only in Ayurveda or in other system, anywhere it is like that. So, only an expert and experienced hand only can handle the situation. We have to analyze the situation or observe the situation seriously and confirm what is the pathology being happening in that particular eye, whether it is in a congestion stage or whether it is in a bleeding stage or in a development of clots are there, or it is in a hemorrhage or serious bleeding stage, like that. We can understand that from signs and symptoms and also by observing the objective signs. On that basis, we have to select which treatment method, what type of medicines are to be used in that condition. That is the success of the treatment. If you are handling that case in time by an experienced hand, success is sure. Otherwise, it will lead to further complications. So, in that way, we can handle the very successful treatment procedures and medicines are in Ayurveda. Success rate is very high.